Hi everyone, I'm Ana Maria, and I am the voice behind most of the Therapy Tip Tuesday posts. I'm here today with my mom, Maria Teresa Ferrer of Ferrer Pediatrics. And so with the community growing so much, it seems like there's a lot of new people that have come into the fold here in the last few days, and we thought that it was about time for her to answer a few questions, so I will be interviewing her, and stay tuned for some answers. So we'll kick off with a little bit about how Ferrer Pediatrics got its social media start. Tell us about that.
Okay, I started my Facebook in 2014. I didn't have any Instagram or YouTube channel at that time. My goal was to reach out to therapists and provide educational courses where we can do follow-up. Through the years that I have been practicing, I was going to classes and there was never a way to continue following up to master the skill that I was learning. So my initial idea was, I'm gonna teach this and I'm gonna continue in contact with the therapist so they will always have a follow-up for questions and directions that they need through the therapy treatments.
So how did you evolve to using social media to share educational posts for parents?
Good question. When I was with my previous employer, I saw that every child were coming after early intervention, which was mostly after 3 years of age. And some of those families were not having access to the therapy, the frequency that they should be doing. So that's when I started posting tips for parents, simple ideas of how to provide therapy at home. And that's basically when I started, that was easier for them to follow up, or also for therapists when they run out of ideas of how to practice some things during the therapy sessions.
Tell me a bit about your favorite demographic to treat.
Okay, I love to work with children from 0 to 5 years of age. I see the most progress, and during my interventions, you see the advancements very early, and that's why I like early intervention. However, I see children post 5 years of age that occasionally I had treated them when they were babies, and they continue to show progress and they advance through the programs that I provide. I am very interested in treating children with brachial plexus injuries, cerebral palsy, stroke, hemiplegic, any neurological condition basically.
Before we open it up to follower questions, is there anything else that you would like them to know?
Yes, I'm independent and I work in my in-home clinic. I provide intensive therapy services and education. The intensive therapy services that I provide, it lasts to families for about 3 to 6 months. I provide them with tools to continue with the therapy. I train them to continue with services either as a supplement from the therapy they receive or as the program. Normally with my intensives, I continuously do follow-ups with families, either as a virtual session or they come back when they see that the child is showing progress and it's time to adjust the program. I constantly receive videos and questions that I try to do the follow-ups and responses immediately, and the parents are always involved and see the strength and the weakness of the child and able to communicate with me to see how can they advance the program. One thing that I forgot to mention, I also travel to places to provide intensive training. If there is a place that they have 3 patients, I will go to their location.